Introduce yourself and
Well, I don't think it is. Okay.
there it is.
My name is Terry Michael. I'm director of the Washington Center for Politics and Journalism. Specific to this program, I'm a 37-year member of the Washington gay community. First of all, thank you for this, and I've never seen a program this long end on time this fast. And I also want to direct this question to Dr. Pappas, the head of the HIV, et cetera, longest named agency I have ever seen in my life, HIV AIDS Administration. I want to ask you about the latest fad, pre-exposure prophylaxis, and what you're going to be advising local physicians. This FDA-approved intervention is apparently going to make a lot of money for Gilead with its Truvada, but a lot of us have questions about this. And I want to ask you this question by example. If I went to my doctor, who happens to be a gay doctor, a mostly gay practice in Washington, has been my doctor for 30 years, and if he said, Terry, thanks for coming in for your 6-month blood pressure check. I've got something new for you. I want you to take these 3 or 4 antibiotics every day for the rest of your life because it will keep you, even though you're 65 and you may someday have sex again, and this will keep you from getting gonorrhea or syphilis. If he said that to me, would he not be engaged in medical malpractice? And if he also said to me, here, take this chemotherapy with its well-assessed 15 years side effects, liver toxicity, renal failure, heart disease. If he said to me, Terry, take this for the rest of your life, it might protect you from this retrovirus. Would he not be engaged in medical malpractice? And what are you going to be advising Washington physicians?
Well, I thank you for the question. This is a national debate, and I think you've framed the issues very well. I personally am very cautious about it. I think one study shows something, but what that one study means in a public health context in a community is a very, very different thing. I think before we rush off and make any great decisions, we need a lot more experience about what this means. I'm also a gay man, so I know my community, and so we got Disco Girl, and she's got her ecstasy pill, and this pill she doesn't know what it is, and then she's got her Truvada pill. She didn't know which one to take tonight. So I have my own severe reservations about it.
But what are you, as the head of the HIV/AIDS administration, going to be recommending to physicians? Surely you have a responsibility to make a recommendation.
We are not making a recommendation right now. The CDC has not made a recommendation. This is an FDA approval. It's been proven that it works in that setting, and physicians in individual practices can make decisions. From a public health perspective, I don't think we're ready to make any recommendations.
So you're not prepared to say it's malpractice?
Not until we have very serious study about the implications in community and the implications that you raise. Other questions? I see someone there who wants to make a question, but no? Well, with that, I thank you. I thank our panelists.